Hey guys, Dr. Richard Alm here. Today I'm going to demonstrate a couple different techniques that we use to address trigger points. And you may or may not have heard of what a trigger point is, but you certainly know what they are if you've experienced it before. These are the focal areas, these contracted areas in the muscles that are really, really tender and achy anytime that you're stretching or foam rolling, or when you go to a massage therapist and they find like an area that's really, really big there. Those are going to be trigger points. And we see these a lot. They're very, very common in musculoskeletal pathologies, whether it's plantar fasciitis, headaches, chronic lower back pain, shoulder impingement. They're almost always present. So in addition to a lot of the other therapies that we use, we're very often doing trigger point therapy. One of the ways that we address it, we have in other videos, is actually dry needling. That's a very powerful way to do it. But a lot of times, we like to use our hands so we can kind of feel the tissue a little bit better, get a better read on how you're responding, and we have a lot more control over the comfort level of it. So we're going to go with Dr. Muse. Yeah, this is Dr. Muse. Nice to meet you. We're going to go over how we would address a trigger point in kind of one of the rotator cuff muscles in the back of his shoulder. And there's a couple ways that I can do it. One of them is just pretty simple. It's kind of the same mechanism that you would use when you're using foam rolling, and that's called ischemic compression. So if I sort of grab his arm here, I actually kind of mix a couple techniques. One is called positional release, and the positional release by finding the position of the shoulder that makes the trigger point as subtle, like not as dramatic or not as pronounced as possible, so it's more comfortable for you. And then we'll find a trigger point in here, which is, again, it's a focal area. It's like a hyper-contracted part of the muscle that creates aching, and radiation when you sort of poke on it. So I can get in here and find a trigger point and sort of move the shoulder around. So there you go. Move the shoulder around, and then once I'm on it, I can just add a little bit of pressure until we start to notice a little bit of radiation. It's always to your comfort level, and then we would actually just hold there for a little bit, and that trigger point starts to sort of twitch a little bit and let go. And when it lets go, any symptoms that it was producing, whether in this case it's elbow pain, shoulder impingement, or numbness in your hand, will just sort of disappear, because they produce a lot of the symptoms that you guys are getting with your musculoskeletal stuff. So that's positional release. I'm sorry, that's ischemic compression. Positional release, we get him to lay on his back here, is even more gentle, and we're going to use the tool or the technique that's going to be the most comfortable but also the most effective for you. So if we found a trigger point in his chest, I can essentially find that trigger point, and I'm going to move his arm around until I find the position where that starts to let go and the muscle tissue relaxes. Then we can hold there, and then that trigger point will actually let go. And then, that's a very, very simple way to let the trigger point just sort of relax on its own. And that's simply by just getting the arm or the leg or whatever into a comfortable position. The last one, if we kind of scoot this way, the last one is we would call Post Isometric Relaxation, PIR. And so that's going to be a sort of a gentle contract, relax. And we use this really cool phenomenon where there's a window after a gentle contraction where the muscle wants to let go. So if I've got him here and I'm going to have him just lightly activate the muscle that we're trying to treat, in this case the pectoralis major, your chest muscle. So I can just have him lightly sort of bring that arm in. He gets a gentle contraction here. He holds there for very little time, maybe 5 or 10 seconds. Keep that contraction, big breath in, and then breathe all the way out and just let it go. And then there's a brief window where we can relax that, or it relaxes, then we can find a little bit longer position without actually stretching the tissue out. So we would do that 2, 3, maybe 5 times, depending on how long it took to get the trigger point gone. But those are 3 different techniques that we use in addition to dry needling to treat trigger points, which are almost certainly a component of any sort of musculoskeletal stuff that you're dealing with, whether it's headaches or low back pain.